One of the most prominent headlines which captured the attention of the country was the announcement of a piece of legislation which seeks to legalize the use of cannabis as a form of medical treatment. It's incredibly controversial, but it does have certain merits. So joining me in studio today to explore this issue further is Dr. Darren Green, Dr. Kevin Stoloff, and Advocate Stransham Ford. Welcome to Doctor's Orders.
Thank you.
Before we begin, let's take a look at how the story came to light.
IFP Member of Parliament Mario Ambrosini caused a stir this year as he tabled the Medical Innovations Bill to legalize the use of cannabis for medical treatments.
More than a year ago, I received a diagnosis of final stage of mesothelioma, which is a cancer of the pleura. And I tried a variety of therapies to delay the inevitable. And I'm now over 16 months beyond my diagnosis and possibly 9 months beyond my deadline or expiry date. And I ascribe the lengthening of my lifespan under these conditions to some of the therapies I undertook, most of which are not authorized and are made illegal by the present legislative framework, one of which has been the cannabis. I went from one treatment to the other. I've done so under home conditions. And I've endured an enormous amount of complications. This is not acceptable. We need to have a hospital where people are allowed to have anything which is available to lengthen and better their life.
The bill not only removes the legal problems surrounding cannabis, but also legally protects the doctors who administer it as a treatment and protects the patient's right to use it as well.
The liberalization of medical treatments for terminally ill patients is something that the people of South Africa want. Read my bill, it's on the parliamentary website, and make your voice heard. And we can put this plant finally on trial, that it may be found not guilty.
Please be aware that we do not advocate the use of cannabis. Our discussion aims to inform you, the viewer, of the facts surrounding the Medical Innovation Bill and its implications. Let's start by trying to understand the use of cannabis for medical interventions.
The uses range from helping with GIT ailments like constipation, acting as a fiber, through to a skin moisturizer, which we use on hands and feet, etc. Lately, because of the prevalence of its mechanism of working in the brain, it's associated with a lot of things centering around neurological pathways. So multiple sclerosis, for example, pain syndromes, and then even obviously things that are involved with mood.
Now, Advocate, you have a vested interest in this bill actually being passed. Could you share a bit of your personal story?
Yes, when I was diagnosed with terminal cancer, there were no probable legal resources available to me because the cancer was too far gone for radiotherapy or surgery. And chemotherapy was financially out of reach, but in any event, that led me to look for alternatives, and among them was the use of cannabis. And some of the stories are nothing short of miraculous. So I went on the protocol, and then I saw Dr. Ambrosini's announcement in Parliament of his condition. And when we came together, we were both on the cannabis protocol. We decided then that as dying men, we could do something for others if we couldn't for ourselves. We formulated the Innovation Bill. We launched the Cancer Treatment Campaign.
And in terms of the experience, your subjective experience of personal use of cannabis for medical treatment?
At the end of last year, I was diagnosed as being in remission. Dr. Ambrosini's condition is more complex than mine, but we both found great benefit from the cannabis protocol personally.
Now let's talk about the general dangers with cannabis use.
It depends. I mean, if we're talking about the recreational user, the dangers are the dangers of smoking, but also there are mental health dangers. So people who use cannabis are more likely to have depression or anxiety disorders in their lifetime. Now, medical cannabis, obviously those dangers remain, but I think the point is that there are many ways that it can be made safer. And the other thing is that everything has its harms, and it's a question about trying to balance the harm versus the good. And I think that's what's important. And just because there's some harms doesn't mean that we shouldn't research and use treatment and try to make the evidence more robust so that people are able to prescribe in a way that's informed and people would benefit.
So with this bill, how will it benefit?
What we propose in the bill is that on an informed patient-practitioner basis, in cases of dread, incurable, dying diseases, that the practitioner and the patient should be able to agree on modes, protocols of treatment that are not widely available, but particularly in relation to cancer.
In the past year, a number of countries have already legalized the use of medical marijuana and dictated its regulation through authorities. Let's have a look.
There's been a recent surge in the legalization of marijuana all across the globe. In South America, Argentina, Uruguay and Brazil are among the countries which have decriminalized marijuana. However, these nations are still in the early phases of experimenting with regulating the substance in terms of sale and production. In the US, states like Washington and Colorado are experimenting with legalizing recreational use, but more than half of the US states have allowed medical use since 1996.
Dan, what are your thoughts?
When it comes to cancer specifically, we've often published case reports and discussions around using cannabis to counter nausea, secondary to chemotherapy. What's come to the fore quite prominently in the media is that we're looking at as an alternative therapy at the moment, not just a symptomatic relief of chemo, but actually being used as a treatment of certain types of cancers. Obviously, the research still needs to be done on that.
And what if young people will use this as an excuse to take more? It's because of my glaucoma or...
Well, I mean, that's always a risk of that, and that's why I think the messaging needs to be very clear. There needs to be more evidence, but in fact there is some evidence, but it needs to be a greater body, number one. Number two, young children and adults are smoking stronger forms of cannabis, putting them at greater risk. And I think while we might be saying that we need to decriminalize, while we might be saying it's important for medical research, while it's important for treatment, we need to also give the message very clearly that people are taking risks because if some people carry one particular gene, the chances of developing schizophrenia is high at a certain time of their lives. So I think we need to be very clear that those messages need to be given at the same time.
Thank you so much, everybody, for joining me for a very interesting discussion. I'm sure this will remain in our minds for quite some time. Remember, we are not supporting or advocating the use of cannabis. We hope that you've gained more knowledge on the subject and can better draw your own conclusions to the issue of the medical use of cannabis.